Now, India has reported 5 cases of HMPV, a known respiratory virus that recently gained attention after a rise in cases in China. Now, the government here has said that HMPV is already in circulation globally and that there's no need to panic. For more on this, I'm joined by Soumya Swaminathan, former chief scientist at WHO India. Ms. Swaminathan, thank you so much for speaking to us here on NDTV. My first question to you is, what do we know about this virus? How is it different from other respiratory illnesses currently in circulation?
So thank you very much for doing this to dispel some of the panic and the myths that are circulating about this virus. As you just mentioned, it's a known virus. It's one of the respiratory viruses that is well known, the human metapneumovirus. And it causes symptoms which are very similar to a common cold or to the flu. So cold and cough and some fever and occasionally some breathlessness. And like any other respiratory virus, like most of them, it usually has mild symptoms which pass off in a few days. But occasionally in some people who either have underlying illnesses or in very small children who have very narrow airways and which get easily blocked, with mucus and inflammation, or in the very elderly, this could actually become a pneumonia. And again, this is a pattern that's common to many respiratory viruses. This is not the only one. So it's just that it's a new family. I think people have not heard about this name very much. It's not routinely tested for or talked about, and therefore perhaps it's come as a bit of a shock to people. But certainly doctors, respiratory specialists, infectious disease specialists, and scientists are well aware of this and have known about this virus family for a long time. The other thing I'd like to mention here is that the ICMR has been doing some surveillance across all the virus labs that it has across the country. And they routinely look at, people who have influenza-like illness or severe acute respiratory illnesses. And of all the cases that they test, about 3% turn out positive for the HMPV, but actually a much higher number are positive for SARS-CoV-2 that we're not talking about at all, and for influenza A and B and respiratory syncytial virus. So this is only 3% of the overall, spectrum of viruses that are causing respiratory illnesses currently. This changes again from month to month. The pattern keeps changing. So We do have data in India that's telling us, what's out there. And it's all local. It's not that it's come from outside or it's come from China or anything. It's been circulating in India for many years.
Right. That's important to note, actually, that there is no carrier from China or somebody who's traveled from China who could be identified as a carrier. But if you could just elaborate further, Ms. Swaminathan, on who is most susceptible, as you said, that probably the elderly or the children, and especially since we know that the first cases identified recently were known have been identified as infants who had no travel history. So it's not important to have any sort of travel history when it comes to this particular virus.
So I think the important thing is a couple of things I'd like to mention. One is that, the numbers that we seem to be counting now, I think that's a bit meaningless because it really depends on the testing that's being done. So if we suddenly start testing millions of people who have respiratory symptoms, we're going to find HMPV in the thousands. If we're going to test a few dozen, then we're going to find them in single digits. In the private sector, actually, this kind of respiratory panel testing is much more common than it is in the government sector. So I think counting these 1, 2, and 3 numbers is actually meaningless because we have this virus circulating in the community like many other viruses. Now, what is important is that people should know what are the warning signs, because cold and cough is very common. Every other person gets it, and everybody cannot have a diagnostic test to find out what virus is infecting them. And there's no need also, because most of the time we're recovering. Now, as I mentioned, if it's a small baby and it gets a respiratory infection, and if that goes on producing some breathlessness, you can visibly see the child is breathing fast, or having difficulty breathing, or coughing incessantly, or unable to take feeds, unable to swallow. These are definitely warning signs for which the child needs to be taken to a doctor. Similarly, in the older person, if you find that person is breathing fast or getting breathless or unable to lie down, unable to sleep, coughing continuously, high fever, which is not coming down, getting dehydrated, person needs to go to a doctor. And again, people who have asthma or underlying cardiac illnesses, if the symptoms get exacerbated, then you need to go and see your physician or your local healthcare provider. But otherwise, you take the normal precautions you would do for a cold and cough. The only thing I'd like to mention is that in India, we're still not in the habit of wearing masks. And I think it's a very good habit to inculcate when you have a cold. Doesn't matter what virus it is. If you have a cold, you're sneezing or coughing, please wear a mask so you don't infect others either at your workplace or home or during your transport, wherever you are in a public place.
Right. Ma'am, I would like to ask you this as well, and it's an important question to answer in the sense that there's a lot of apprehension around this particular virus because the common understanding is that it is coming from China, or like people are getting affected because there's a rise in cases in China. So is there any similarity between HMPV and COVID that we know of?
No, there's no such correlation. The coronavirus is another group of viruses. The HMPV is a very different kind of virus. Of course, SARS-CoV-2, we still don't know, the origin of that virus. But the fact remains that today it's a virus circulating amongst humans, even though we may not know the original animal that it came from. But in terms of HMPV, again, it's a virus that spreads from human to human. We know how these viruses spread through droplet infection and through airborne transmission. We also know very well now what are the precautions that we can take to prevent that kind of spread. So those are all common, I think, across all of these different viruses. The only other aspect really is that maybe in a way this is a test for us, for the public health system, for scientists, and also for our communication, risk communication, public health communication. How well are we going to do it when we are faced with a real threat of a new epidemic or a pandemic? These kind of thing maybe allows us to test the system a little bit, and also maybe put a little more focus on surveillance, genomic testing, and the communication of those results to the public. We need good public health communication so people don't get into these kind of panic situations. And on the R&D side, of course, we need to invest in developing what are called countermeasures, which are diagnostics, drugs, and vaccines to deal not only with HMPV now, because we're hearing about HMPV, but with a whole family of viruses and bacteria that we know are threats to humans, and that can, at any time in the future, become potentially an epidemic or a pandemic.
Right.
So the pandemic preparedness report that was prepared by the Niti Aayog sets out a very good roadmap for us to follow.
Ma'am, any concerns that there might have been a mutation of this virus? Because although, as we know, that news coming out of China is very difficult to track, but there has been a surge in cases. So as you mentioned, and we commonly know now that HMPV has been in circulation, it's not a new virus, but any concerns of any mutation for which we need to be extra prepared, or there should be some kind of preparation done by our scientists and doctors here?
Well, that's a good point. And that's, again, one of the lessons that came out of COVID, and one of the capacities that we were able to build through the network of genomic labs and the INSACOG network and so on. So from what data we have now, there doesn't seem to be any new mutation in this virus. It's the same virus, whether it's China or India. There's been no mutation, nothing new of any kind of concern. But obviously, the National Institute of Virology and others are going to keep tracking the virus to ensure that, there's nothing to be concerned about. But as of now, no new mutations, no.
Right. Ma'am, it's very important to actually talk about the measures to protect yourself. As you were rightly saying, that the government needs to have a very clear communication. That is what they can do in terms of keeping people informed. But somebody looking at this program right now, what would you tell them in terms of the precautions that they need to take, especially for the vulnerable like the elderly and children?
See, we need to pay much more attention on prevention, as you correctly just said. And we know that seasonally we have, we are exposed to different kinds of viruses and pathogens and so on. For example, in the monsoon, we know that vector-borne diseases like dengue, they start spreading much more, especially in our cities and urban areas. In the winter, cooler months, we see an increase in respiratory viruses. And I must say that air pollution also plays a major role, not just in predisposing people to these infections, but also causing them to become more severe than they need to be, because the human lung and the airways and the immune system is fighting not only with the virus, but it's also trying to deal with all of the pollutants that are going into our respiratory tract. So the inflammation that all of that produces is very, very harmful for the body. So what are the precautions? It depends on what you're faced with. If it's an outbreak of respiratory illnesses, then we can go back again to the lessons we learned from COVID. Keep a distance, especially if you're infected, if you're coughing and things like that. Please wear a mask. Keep your mask on, especially if you're around your loved ones and if you're going out or in a crowded bus or a train or something like that. Wash your hands, because again, droplets tend to fall on your hands, and your hands touch many objects during the day and you can be spreading the infection. Just take symptomatic treatment, drink lots of hot fluids, have paracetamol if you have fever or body ache, and some soothing drinks, and just wait for this to subside. I already mentioned some of the warning signs. If you become breathless, you're coughing continuously, unable to eat, start vomiting, those are definitely warning signs that you would want to go in and see a doctor for. And I think spread health literacy, health awareness amongst each other. Don't, rather than create panic, I think let's educate ourselves, to deal with these things rationally.
Right. Soumya Swaminathan, former chief scientist of the WHO in India, thank you so much for joining us on the broadcast on this very important discussion.